Thank you, everyone, for being here with us today, Safe, Vibrant, and Healthy Community Committee. We're going to continue the discussion on downtown public safety. Evan?
Certainly. Good afternoon, or not quite yet. Good morning, Mayor, members of the committee. So as the Mayor indicated, last month we began a conversation about various efforts that we were taking to enhance safety in various areas throughout the downtown. There was a lot of conversation among the committee, among the members of the public. And so there were several key thematic areas that sort of emerged from that conversation. Obviously, efforts specifically addressing safety at the transit center, efforts to address safety in other areas adjacent to the transit center throughout the downtown, and conversations about public health resources and behavioral health resources. And so today we have a series of speakers that will address each of those topics. We have with us from the county, County Manager David Ellis, Assistant County Manager Denise Foreman, Dr. Jose Cabanas. You will also, after they present on the behavioral health programs, you'll hear from DOT staff that will speak to recent efforts to secure private security in the transit center. We'll also preview some policy discussion around the current fare policy. And then lastly, we'll hear from Mr. Bill King with the Downtown Raleigh Alliance about some of their recent efforts to address security in areas immediately adjacent and kind of throughout the footprint of downtown, among other things. So with that, Mayor, I'd welcome Ms. Denise Foreman, Assistant County Manager, or maybe David Ellis, the County Manager, if he'd like to come and begin the presentation.
Mm-hmm. I just want to thank the county for being with us today. There are a lot of questions about health and human services, and I think this will be educational for people. County is responsible for health and human services. We are a partner, and appreciate your efforts, and thank you for being here.
Sure. Good afternoon, Mayor, members of the council, and the public. I thought it would be helpful to start off kind of an overview of what health and human services is in Wake County. And this is under statute from the state. So when we talk about health and human services in the county, we're talking about social services, which includes child care, Medicaid, family nutrition services, heating and cooling assistance, adult protective services, and adult guardianship. We also are talking about child welfare, which includes child protective services, foster care and permanency planning, and prevention services. In addition to that, public health is a large portion of this agency, and what that includes is communicable disease and prevention, maternal and child health, prevention and wellness, emergency preparedness, and also, as you all know, health clinics are also included in our health department. And what they provide is direct medical care, treatment and support services, women, infant, and children, which is a nutritional program for pregnant mothers. And they also operate a pharmacy there where individuals can have their prescriptions filled. Not included in health and human services is our housing department. So we have a housing and affordability department. And where they work in the space of homelessness is, you've heard about the South Wilmington Street Center. It's a men's shelter, and that shelter is continuing to serve single men in the area. We have been successful in getting about a quarter of those individuals housed as they go through the shelter, which is tremendous. We also operate in partnership with Urban Ministries, a single women's emergency shelter, and the Salvation Army operates a family shelter for those individuals. We recognize that we needed more resources, and so our housing department started a Bridge to Home program, which was launched last year, and so we are now funding individual organizations who are providing enhanced services to individuals who are homeless, trying to make sure that they are able to find a home. We also have a landlord engagement unit. One of the things that runs throughout everything we do is partnerships, and we recognize that landlords have an option these days. And so our staff has been working closely with landlords making sure that they know if there's any damage or anything done. The county has built in some resources to address that so that we can encourage individuals to rent to folks who are eligible. We also offer Wake Prevent, which is trying to ensure that families who are kind of living on the edge, they may have received a vacate notice, if there's a way of helping them with their resources to keep them in their home. One of the things we all know is that it's much more difficult once you've been evicted, and so our goal is to help keep individuals in their home. And so wanted to kind of set the stage for that so you have an idea of what kind of the Health and Human Services portion of Wake County does, what the Housing Department does, and I'm going to have Denise and Dr. Cabanas talk about the behavioral health piece of all this. And again, all the services and programs we offer, we partner with the city, we partner with municipalities and nonprofits. We could not do any of the things and be successful with those without our partners. And so, Denise, if you would talk a little bit about behavioral health.
Thank you, and thank you for the opportunity to be here. I'm going to build off of the mayor's comments and then David's about partnerships. The way behavioral health is done in the state of North Carolina might look a little different than any other state in that counties don't provide behavioral health services in North Carolina. The state laws changed about 12, 15 years ago, and we were a provider of services then, and those services are now provided out in the community by community providers. The county continued to invest in services even though we no longer provided them. And so our dollars actually go to a local government entity called Alliance Health. They're a local management entity and a managed care entity. And so they use state Medicaid dollars, state dollars for behavioral health services for the uninsured, and then we provide additional funds to them to help cover the gaps that aren't covered by Medicaid and the state funding. The funding that's provided to this entity is not sufficient for the volume of need pre-pandemic and certainly not today. So we, as you all, are seeing a lot of suffering across the community from folks that have means and those that don't. So a lot of what we do at the county is really trying to bridge together the work that's done in the area of behavioral health, both the programs that we invest in, the programs that are funded through other means and sources like your private insurance or philanthropy, and then bridge together along an entire continuum. So people enter the behavioral health system in a number of different ways, and it's very confusing. No two paths are quite the same. And individual experiences, individuals' trauma, individuals' life stories impact the way they may need to access services at any given time and along the whole continuum. And many times behavioral health is not a one-time episode, it's something that may continue along with an individual and be complicated by many other factors. So we work very closely with our municipal partners, our court partners, with our housing folks across the community, with payer sources like the state government and insurance companies, with our hospital systems. They are a big player of ours here, the way mental health is done in Wake County. And so one of our large roles is really to assess and understand. We do a community health needs assessment. Behavioral health and substance use needs have been one of the top priorities for a number of years. And so we continue to invest. Our commissioners have increased those investments in recent years, but we know it still falls short of the overall community need. We focus our work in 5 key areas. One is access and coordination, helping people know how to access behavioral health system and how to access services when they can be available, and then to help coordinate, as I mentioned earlier. So we have a focus area of access and coordination. We have a focus area of crisis services for youth all the way up to our senior adults, helping folks know who to call, when to call, and at what level to call, because there are programs and services available. But being able to focus those around crisis. Crisis has been an area of need and opportunity for us. We recently had a consultant do a full crisis study looking at the entire continuum across Wake County of what we have and what we don't have. And so we recently just wrapped that up earlier this year. And there are about 10 key recommendations that we're working through to get some of those opportunities identified and see what we can do to get those addressed. We also have a key focus area of criminal justice and really trying to help folks avoid incarceration and access treatment when appropriate, or if they have been in the justice system, getting them connected to appropriate services if that will help them in their reentry and recovery. Then, as you know, housing is a key component for all individuals. Housing is healthcare. Without safe and stable housing, it does cause more trauma and it results in unwell consequences for individuals when they don't have that stability. And so we know that that's an important component of a behavioral health journey is having safe and accessible housing. And then our fifth key focus area is familiar faces. So one of the things that we know is there are a number, typically a small number, but high volume individuals in the community that cycle in and out of our systems. They're active users of our EMS, active in our hospital systems, active in the homeless system, and we see them often in the court system. And so we're working to bring together data about these individuals so we can better connect them to the programs and services. We are fortunate, we do have a lot of programs and services, but it is often difficult to connect from one service to the next, and you may need multiple services to be able to assist you along the continuum of needs that you have. So those are the 5 key areas of how we approach the work that we do around the area of behavioral health, and then the investments that we make through our partners. I can go on and on for quite some time, but those are, I think, the highlights to help you kind of get a picture of our role as a county in behavioral health and how we use the investments that we have available to us.
I was going to ask if,
Good morning. Just a quick, thanks so much for the invitation. Just a quick, adding additional comments to what the manager and Denise just shared. Also, consider that the EMS system in this community, which is, is very well integrated into a lot of the programmatic functions that have been shared already. So our team members every day, when they encounter some of our most vulnerable residents in the community, they do the very best to connect them to the best resource available to them that can address some of the core circumstances that are affecting their well-being and their healthcare. So we do a lot of work in coordination with, obviously, sometimes law enforcement, but also with some of the community partners that Denise has and David have shared already. So a lot of that work is trying to integrate and connect all these dots together so we can better serve the community in that capacity. And I'll be taking any questions.
okay. Councilmember Fort.
So I guess my question is, and it's probably multiple parts. Thank you for standing, Denise, because it's probably directed to you. How many inpatient facilities do we have in Wake County, and how many beds does that translate to? And then the second part of the question would be, what is the need in terms of adding additional inpatient? Because I'd imagine that a number of the folks that law enforcement and other people encounter are folks who probably need inpatient assistance versus outpatient, where their functioning level probably has to be a little bit higher so they can stay on medication and stuff like that.
Sure. Interesting. Thank you for that question. Great question. I don't have my data in front of me, so I don't want to give you wrong numbers, but we do have 3 private inpatient hospitals. So those with insurance obviously are more likely to have places to go. We have contracts so that uninsured individuals can access care at those facilities as well. But that's Holly Hill, Triangle Springs, and Raleigh Oaks are the 3. And one of those includes youth and adolescents. And then we have one public, that's at Wakebrook. They have 28 beds at Wakebrook. It's currently closed because we're transitioning providers. UNC Healthcare was the provider there, and we're transitioning. Wake Med is being announced today as our new provider at Wakebrook inpatient. So those 28 beds would be online, but they're not. So that's 28 that are offline. Holly Hill Hospital has a couple of wings that are licensed, but they are not staffed because they can't recruit and retain the staff to operate quite a few of their beds. And then Raleigh Oaks is newly reopened. They were a previous provider. They were closed, and so they are operating at about 50% capacity while they work to recruit and retain. So collectively, you add all of that together, and we're actually over 100 inpatient beds that are not available in our community for either transitioning providers or they don't have staff to be able to operate them. At the state hospital in Butner, a lot of the folks that we see that are in most severe crisis would historically have been in a state hospital, and they have about a 44% vacancy rate with their staff. So they also have many beds that our citizens would have been accessing had they been staffed. So having access to inpatient services is really important. Most of you are familiar with behavioral health reform. Over the years, there's been a lot of work to keep people out of long-term inpatient facilities and get them back into community with supportive housing and access to ongoing services. And so while we do have a number of beds that would traditionally have been available had we had the support and the providers to operate them, the goal would not be for them to stay there long so that they can get back and enhance the community.
Councilmember Jones?
Thank you so much for being here. And just a follow-up to that, I know you said roughly 100 beds. If we were operating at capacity and able to serve, how many beds do you think we need?
A great question. It depends on who you ask. Because again, that philosophy, you really don't want folks in inpatient beds. And so there's a lot of assumptions that you can make. WakeMed, I will say, has recently conducted a review of the capacity needs that we would have in this community, and they have determined that they're going to open a new 150-bed behavioral health inpatient facility that'll be in Garner. And so theoretically, you could say about 150 would help fill that gap. They won't be open for several years. They recently just identified the site and got permission from the state to move forward. But about 150 for sure are coming online, and we know could help fill that gap.
And that would make you feel confident that we are serving the need?
Yes. Again, you got to have a continuum of programs and services, because once somebody's an inpatient, once they're discharged, what are they discharged to? And so what we know for a lot of the folks that we visibly see that are suffering from behavioral health or substances is they're not able to connect to the resources in the community that might be available to them for whatever reason. And so we see that they may be unhoused or not engaged in treatment. And so having those inpatient beds would be incredibly helpful. It's only a piece of the continuum.
Got it. Thank you so much.
For sure.
Denise, could you talk a little bit about the partnerships that you have? I know the nonprofit partners play a critical role in addressing housing and working with our unsheltered population. Can you talk about that a little more?
Yes, ma'am. As I mentioned, we had our crisis consultant evaluate our entire system earlier this year. And one of the findings is we are a very fortunate community. We do have tremendous partners that have stepped into the space of behavioral health and provide a full array of programs and services. And so we directly work with a couple of key providers in town around the areas of substance use and mental illness and co-occurring needs, and their ability to reach folks of all walks of life is really remarkable. And so we're super fortunate for that. There are many of them, so I won't go through the list, but we have them in Raleigh, and then outside of Raleigh in our other communities as well. So they play a huge role in the early intervention and prevention at the very beginning of someone's journey, or early access to care and treatment, or along somebody's full lifelong journey if their need goes on for multiple years of their life. So our nonprofit community providers and partners are really the continuum in addition to what we see in the medical community.
So I believe what you're kind of touching on is one of the areas that we've discussed, and we realize there needs to be improvement in the system, right? The system is partly the hospitals, it's partly Wake County, it's partly the city, it's public safety. And all of those things, we've never really had a system of care for behavioral health that this community deserves, right? And so there are now people at the table who are like, we can do better and we should do better, which is the direction we're moving towards.
And I would add to, so the inpatient piece is critical, is needed, but we have to at the same time sort of restructure, refocus the other domain. Oh, so I'm sorry. So the inpatient piece is extremely important, but it's if the other domains are not impacted, affected at the same time, sort of transform or structured to provide better services. It's a one piece that it doesn't provide the whole continuum of care.
Councilmember Patton?
Yes, hi, thanks for being here. I got a handful of questions. The easiest one, does the county provide case management services?
We don't provide any services, but we do have contracts. Our funds do help support case management.
Got it, okay.
Yes.
Okay, and then I appreciated what you said, that housing is healthcare. I also made note that we mentioned at the South Wilmington Street Shelter, we're getting about a quarter of the participants into housing. I have heard of other states utilizing their Medicaid expansion dollars for housing, and I know Medicaid just got expanded in our state, so you probably haven't had a chance to operationalize it, but what is your vision for how Medicaid expansion might impact some of these services?
Thank you. Great question. We're super excited about Medicaid expansion. Long time coming, and we think this population in particular is going to be served much better because of Medicaid expansion. Additionally, because of the Medicaid expansion, there are funds that came to the state of North Carolina, and they, in the approved state budget, are investing about almost $1 billion in new money in behavioral health that hasn't been there before. So really excited about some of those initiatives. And because of the way the state has been exploring how to best use Medicaid dollars, there have been some pilot projects going across the state of North Carolina where the federal government has authorized North Carolina to use Medicaid to help provide for housing, transportation to key appointments, and then food security issues. And so those pilots have gone well. They're very promising. And so we are hopeful and expect that with permission from the federal government, North Carolina's Medicaid dollars will be able to be used to help support those programs for the entire state. They're wrapping up those pilots now, and so there's a lot of momentum to move that forward and broaden those definitions of how Medicaid can be used to help support housing needs.
When do you think there might be a more definitive answer on that?
That's a great question. Very soon. The state is submitting their waiver to the federal government last week or this week, and I think they expect an answer very soon because
end of the
Medicaid
year?
expansion is December 1st. And I don't remember the timing of how that aligned, but I would expect we might could hear something as soon as by the end of the year from the federal government.
Okay, cool. Another set of questions I wanted to ask about was more about the South Wilmington Street Shelter. What is its capacity? Are you operating at full capacity? How many people are we serving there right now?
So I believe the number is 160, and so we are operating at full capacity. And part of this is the South Wilmington Street Shelter is a program, and so our goal is to get people into permanent housing, right? And so, and we've been more successful since the pandemic as we focused on providing individual counseling and really working one-on-one with individuals. Mm-hmm. We do have, if there's an emergency and we need to open up and we need to increase, we can do that, but that also impacts the programmatic functions, so.
Got it. Is 160.
60.
So I know y'all had some pretty significant like COVID public health mitigation strategies. Is this 160 is when we've lifted some of the
Yes.
COVID restrictions?
So the COVID restrictions are gone, but the 160 is where we are getting positive outcomes with individuals, right? And we're not, people are getting individualized counseling resources. When you put too many folks in there, and we've, years ago we used to do that, we weren't getting the same results that we're getting now.
Okay, so you used to serve more folks in like a more acute way, but you're saying you didn't have the same positive
Right.
results. And so you feel like 160 is the sweet spot.
It is, and we've had a decrease in the number of altercations and incidents with that number. So
How many would you say roughly were you serving in that sort of pre-time?
I think it was around 190, 200.
Okay. And do you know where, I'm wondering about like our nonprofit partners who might be absorbing the difference?
Well, we did, we're contracting with Healing Transitions to provide some shelters. And so we're doing more coordinating and with contracts. Is there still a need? Yes. I mean, part of the problem is we just don't have enough shelter space, right? And so we need more family shelters. We need more shelters for single women and children. And so we're looking at that, and there's a study that will be presented, a facility study with some recommendations, I believe, before the end of the year.
Okay. Okay, thank you.
Before you go, really quickly, I just wanted to add on a question. And now I've lost it, so I'm going to come to my next question. How can we best connect those in need of that housing to you or to the county to find that? I'm not sure what that path looks like.
So there really isn't a particular path, because a lot of times, like, we have folks who we contract with who actually provide not case management, but they're actually out in the fields, meeting with individuals who are homeless, providing them information, right? So we have some county staff, we have some nonprofit staff who we contract with who actually do that type of work. I can get you all some information if, in terms of a number to call, we can get you that. One of the challenges is we just don't have enough units, right? And so we've added, I know between the city and the county, we've added a number of units over the past few years, but unfortunately, we've also lost a number of units. And so part of this is increasing the production on the ground. Part of this is actually working with individuals so that they have the opportunity to climb that economic mobility ladder that Dr. West talks about, because we want to get people housed, but we also want to give them opportunities to progress if they so choose.
And then I do remember my question. So as this study that you're speaking of comes back out and the recommendations come forth, is that going to be on the county to build those units, or is that a partnership? How does that look once those recommendations comes out? Whose responsibility is that?
Sure. We're Assistant Manager Evan Raleigh said the city was going to take care of everything. So
I'm sure he did not say that.
No, and so traditionally we partner with the city. We look for federal funds. If you look at Oak City Cares, that was a joint funding agreement between the city and the county. And so we'll work together on that and identify funds to move forward. And
then my final question, as we look, because you as the county, you have many municipalities, it's not just us. How do the other municipalities play in a role in this? How can we work better together so that we're serving the need of everyone? Because I'm sure each municipality you go to is experiencing similar issues with the unhoused, but I think the majority of it might be here in Raleigh.
That's a good question. So it varies, right? It varies. In some places, it's not as visible as it may be here. But we've had one of the bright spots over the last 5 years has been the number of municipalities that have developed their own affordable housing strategic plan, right? And so we have conversations, and one of the things that we've got to figure out, as we look into the regions, how do we serve those folks out there? Is it utilizing some of our regional centers, some space in our regional centers? Is it finding a way to get folks transported to a central point? We haven't made any decisions on that, but we know that this is going to grow, not just in Raleigh, but out in the municipality. So that is something we're trying to be strategic and think about going forward.
And do we meet together as county? I mean, this might be a question for city manager. Do we, as Raleigh, meet with the county to? I know this can be considered a meeting, but we don't have all 8 of us here. Do we ever sit and go through ideas together, or how does that relationship work?
So I know that Evan and Dwayne Holder, Lorena McDowell, our housing director, and Larry Jarvis, before he retired, would meet on a regular basis and have some of those discussions.
No, I think just to further what County Manager Ellis is indicating, yes, staffs are constantly in communication with each other about various issues related to this topic. So, we try to make it a point to maintain those lines of communication and share ideas, because I think we realize that we're, better together, that this is an issue that any individual jurisdiction or entity can tackle on its own. And so, we take great pride in fostering that relationship and maintaining that communication.
Thank you.
Okay.
All right.
Thank you for being here. We really appreciate it.
Sure. Thank you all.
Okay. I know you've got to get back to, is it okay? Okay. If you could come up to the microphone, please.
Phil Poe from Glenwood, Brooklyn. I just want to know, how big is the problem, and to what extent are we reaching? What percentage of the people are we reaching, and what is sort of your goal in terms of the number of people you'd like to reach? I'm sure some people just will resist getting in the system, but the key question: how big is the problem?
So I believe at our last point in time survey, the number was about 1,200 homeless individuals. In a perfect world, we would get all 1,200 housed, and that's still our goal. It's going to take some time because as we house some folks, we may have others come into the area. But that would be our goal, is to eliminate it. And some people will say it can't be done, and maybe it can't be done. Maybe it can't be done, but I think that should be our goal.
Okay. Thank you.
Thank you.
So next up, Mayor and Committee, we have members of our Department of Transportation staff that are going to come and speak to you about the conversation we started last month about efforts to secure the transit station, and also debut some discussion around our current fare policy. So we've got David Walker with DOT that's going to make the presentation to you.
Good morning. David Walker, Department of Transportation Transit Division. And just a quick follow-up to some information we provided at the last subcommittee meeting. We, in collaboration with our contractor for Go Raleigh, reached out to 3 different security companies in the Raleigh area, had conversations with them about providing additional service within the Go Raleigh Transit Station. All of those companies we talked to relayed that they recommended we have armed security officers on site. Preferably, we would like to have company police, but unfortunately, that's just those staff aren't available with the private security vendors. They try to get them as frequently as they can, but it's just hard to come by. So the armed security is the next best solution. And noting that armed security does not have police powers to arrest or detain. Where we are today, we continue to work on a short-term contract with Capitol Special Police. They are the city's current security provider for this building and One Exchange Plaza, and they are ready to implement security officers on the street or in Go Raleigh Station as soon as we're able to offer a notice to proceed. Our goal is to have two-person shifts operating a span of 20 hours, so 2 10-hour shifts with 2 persons on each of those shifts. Our long-term goal and next steps would be to develop an RFP and go through the full procurement process for a long-term contract. We could either do that internally as a city contract or potentially through our contractor, RATP Dev, who manages and operates the Go Raleigh services. Obviously, we will coordinate with our Raleigh Police Department and their transit police and the DRA as we develop and go through that procurement process to make sure we're all working together to come to a solution to the issues that we see today. And once implemented, then we would be having regular meetings with the Raleigh Police Department leadership to make sure that that ongoing collaboration continues among all parties. And that's what we have on the security. If you have any questions, be glad to answer.
Any questions?
Yeah, happy to start.
Councilmember Patton?
Hi, thanks for the presentation. So, well, I have a handful. I'll try not to hog all the airtime. Can you just remind me, what was the action that RTA took at their last meeting related to this topic?
They did not take any action.
Okay.
We discussed a funding request that went through the TPAC, Transportation Planning Advisory Committee, but the Transit Authority does not take action on those requests.
Got it. So they will eventually take action on it, or I'm trying to understand the relationship between RTA and any future action we would take.
So the Wake County Transit Plan half-cent sales tax generates tremendous amount of funding toward transit projects, and they support just about all or 100% of all future growth of our transit system. So one of the things we submitted an amendment request on this year was for some security services based on the recent issues we've seen in the downtown area and especially Go Raleigh Station. So that funding request goes through that TPAC process. So the Transportation Planning Advisory Committee reviews it, approves it or not. If they approve it, then it goes to the CAMPO Executive Board for approval and also to the Wake County Commissioners for approval. If those two executive boards approve that funding, then we would develop an interlocal agreement between the City of Raleigh and the Go Triangle Tax District that allows the city to receive those funds. That contract comes to City Council for approval, so that's the first time you would see it. Assuming that funding is approved, then we do this RFP. That contract ultimately comes before the City Council for approval also. So the request that has been sent up already is simply a funding request. Obviously, there's a scope that has to be attached to that, so it talks about the security and what we're requesting, but it's simply a funding request.
Got it. Okay. Thank you for that clarity. That helps a lot. I appreciate that. I'm also interested in if you can share why the security companies wanted to be armed. If they're not company police and they're not empowered with the same powers as police, why would they want to be armed, or why would they need to be armed?
I can say that that's probably I may need to come back to you with a response on that. I may need to confer with them and get their professional opinions. But based on the environment, that was their strong recommendation, that in order to have the respect of the community, that would be a requirement.
Yeah. Councilmember Patton, on that point, I do have a bit of, excuse me, a bit of insight into some of those conversations. My understanding is that it was made clear from the security companies that we spoke to that not only for the safety of their personnel, but their perceptions of the risk associated with the current environment, that those were the factors that led them to say, excuse me, that it was their strong recommendation. And in fact, my understanding is that they were not willing to provide the service if their personnel were not able to be armed.
If they're not empowered with the same authority as police or company police, what are the circumstances in which they could discharge the weapon?
So I think those are conversations, as David alluded to, that are police department, the police chief have been kind of intimately involved in this conversation all along. I'll say that's something that the rules of engagement, so to speak, are one of many conversations that we will have with whatever provider is selected to do this in the long term. So those are those details that would come, and there'd be an understanding on day one about, you know, rules of engagement, the way that those two entities will work side by side.
Got it. And we've had residents ask about whether they'll wear body-worn cameras. I guess that is also part of that conversation.
It is.
Yet to be determined.
It's part of the discussion, yes.
Thank you. All right. I'm sure I have more, but I'll pause for now and pass the mic.
Actually, I can say that the body cameras, or the cameras, are part of the contract.
Councilmember Jones?
Thank you. Just some clarification. I was speaking with City Manager Michael Moore earlier, and just some clarification, and maybe you didn't, and I apologize. There are two pieces to this. This is the short-term contract, which does not come before us again. Once this is approved, this armed, we're not going to see that again. The only thing we're going to see is the next thing, which is the long-term contract if we go. So the immediate need for the armed officers will happen whether it comes to us or not, which is, from my understanding, it's not going to come back to us.
Yeah, the dollar value of the contract doesn't meet the threshold for city council approval.
What is that threshold?
I believe it's 300,000.
Sorry. And then, yeah, no, I had the same questions that Councilwoman Patton had, so you've been answered. Thank you.
Any additional questions? Okay. Next part.
All right, and so we also wanted to bring up Go Raleigh Fairs. That's been an ongoing conversation with our Raleigh Transit Authority over the last year, and how that may relate to the same topic with safety and security of our bus operators. So just want to give you a quick overview of what our fares are. Our pre-COVID, our base fare was $1.25, and that provides you with one trip on one bus. So double that. If you know you're going to have to have a connection, you would buy a $2.50 day pass, which allows you to ride all day. Those fares directly from the fare box accounted for about $3.5 million in revenue for Go Raleigh. All of that goes right back into the Go Raleigh budget and helps support the services that we provide. Our Go Raleigh Access program provides about $900,000 pre-COVID, and our Go Pass programs, which is an employer-paid program that they provide for their employees, either through downtown corporations or major universities, and even smaller universities generally participate in that. That's about another $500,000 worth of revenue. Some existing programs that we currently have. We developed this slide right before COVID hit, as we were looking at potentially doing a low-income fare program. So today, or pre-COVID, 32% of our riders rode for free. And that was made up of senior citizens, children, 12 and under who ride for free, teens, 13 to 18. We developed a Youth Go Pass program through the Wake Transit Plan. That's another program that's supported by the Wake Transit Plan. So all teens, all children ride for free in addition to senior citizens. And then those with the opportunity to have a Go Pass through their employer got to ride for free. Again, that Go Pass program is paid for by the employer. In addition to that, Go Raleigh offers a 25% discount to nonprofits for bulk purchases. And in the year prior to COVID, we sold about 100,000 of those passes, which provided an additional huge number of trips for those persons receiving those passes. And in addition to that, FTA and the ADA requires that we provide a half fare program for persons with disabilities. And through that program, we provided about another 12% of our total annual ridership to ride at half fare. So between the free programs and the half fare, we've got about 44% of our riders riding for free or at that reduced rate. So we got we feel like we've got a pretty good low-income fare program already, but we would like to build on that at some point. And just, again, a reminder that fares were suspended at the beginning of COVID in March of 2020. That was done primarily as a safety need for our bus operators. We actually closed the front door and required all boarding and deboarding from the bus to happen from the back door, just to provide additional distance between our employees and the general public. If the council were to consider returning fares at some point in time in the future, there are certain impacts that we have to consider. You know, our equipment's not been used in 3 years to collect fares. We've got bus operators that have never collected a fare just because it's been 3 years since we've had to do that. So a lot of technology and operations staff training that will be required as we move toward that, if we move toward that. And that's all I had on that. I'd be glad to take any additional questions.
Councilmember Fort?
Yeah, can you go back to the slide of the discounted fares and some of the policies that were implemented pre-COVID? Yep, that's the one. So if we were to consider reinstating fares, would you keep these free and existing programs as a part of that new structure?
Yes, all of this is part of our existing fare structure. Senior citizens have ridden free, I believe, since I started back in 2001. Children 12 and under have always been free. The Youth Go Pass program, that was new with the Wake Transit Plan. I believe that started in 2018 or 2019. In the Go Pass program, obviously, nobody's participating in that because they don't want to pay because the fare is currently suspended, but we'll certainly be reinstituting as much of those as we can.
What is the cost of the Go Pass?
That's a good question. I believe the Go Raleigh only Go Pass program, we charged the employers, I believe it was 67 or 68 cents per trip.
Okay, so about half.
Don't quote me
cost.
on that, but yeah, yes.
Okay. Any additional questions? Councilmember Patton? Let's finish with the council first, please. Thank you.
How does one obtain a Youth Go Pass?
There's an application that is available. When we implemented that, let me think back because it's been a while. I think Wake County Libraries, all City of Raleigh community centers, obviously available through our Go Raleigh station information booth. I believe we even had it online. It could be downloaded so that it could be filled out at home with the assistance of a parent. And then that application has to be brought in, and then you're assigned a Go Pass.
And there's a physical pass?
Yes, there's an actual pass that they're issued that they swipe on the bus to help us count and track the ridership.
Got it. Awesome. And then another question is around the technology that you mentioned. Will there be, in addition to training the bus operators and like kind of dusting those fare collection tools off, like are there some technology upgrades that we'll need to make having been 10 years? And what do you think would be the estimated cost of that? So we had a mobile ticketing program ready to deploy right when COVID hit. So that was at, I would say, 95% ready to deploy. And obviously we put the brakes on that. We have paid a small stipend to that company monthly during the pandemic, or since that time, just to keep it kind of sitting on the shelf and active for us. So there'll be a little bit of QA, QC that we have to go through to get that spun up. A new added feature that we want to add to that will be a tap and go reader, so that if you get on board the bus and you don't have cash, you can tap your debit card or your credit card to pay for your bus fare. We have reached out to them recently, and I believe the cost of those are about $1,200 a piece, times 120 buses, give or take. So there'll be a potential Wake Transit Plan amendment funding request for those to help support that. The mobile ticketing program does have a fare capping
not an option. It's something that we did exercise, so that will be a benefit of the mobile ticketing program. So if you're participating or if you're using mobile ticketing and you're paying a cash fare daily through that mobile ticketing program, if you're a regular rider on day 5, it automatically upgrades you to a weekly pass. So you would pay for 5-day passes, and then you get 2 days for free. And then similarly, on a monthly pass, you would be upgraded after day 23 of purchases. So the fare capping allows you to get free upgrades to those weekly and monthly passes.
Okay, that's helpful. That answered the question I hadn't yet asked, which was, I know that there was a barrier for some riders when there were fares because having $1.25 exactly in cash was not always a realistic option for a lot of riders. And so sounds like you were already working on that, and it's kind of queued up and ready to go. So, cool.
Yeah, the tap and go will be a new thing. We've just started talking about that and just received some initial quotes, but we feel like with a 6-month timeline, which is about what it'll probably take to get all this stuff spun up and ready, we feel fairly confident we can have that deployed and active on the tap and go when we begin collecting fares.
Okay. You done? Okay, sir, if you would come to the microphone, give your name. Let him finish.
I'd like to speak at this from a black person.
Could you give your name, please?
I've not heard anything about.
Sir, could you speak in the microphone and also start with your name?
I'd like to come at this from a black perspective. I've not heard anything about the root cause of all of these problems, especially from the mental health process. I would like to see an open forum where people can sign up and people from the audience can try to help these entities to help solve some of these problems. Because when I was in school and before integration, there was no mention of mental illness at all. Kids weren't bringing guns to school. We looked after one another because it was a community and a village. But after integration and after Donald Trump, everything, killing somebody's normal now, being disrespectful, misbehaving, kids carrying guns to school, none of this was happening prior to integration. And I want to see you have an open forum, maybe limited, where people from the black community, since it impacts us most of all, when these entities or squads come up and talk about mental health and mental illness, it seems like everybody wants to play crazy now. That's a get out of jail free card if you're mentally ill. I do believe that there is a legitimate diagnosis for mental illness, but there's a difference between mental illness and criminal illness. Because if you stab somebody and kill somebody and try to get away, you're not crazy in my book. If you can get up, know when to get up, when to eat, when to shower, and when to get on your phone all day, it just seems like that word is overplayed. And it seems like it becomes numb after a while. Because when I was in school, I'm so blessed and privileged to have gone to a black school, because if you didn't learn it, they would beat into you. And we were taught to fear the Klan, and we grew up with adversity. And that's why we had to make a way out of no way. And since white kids have grown up privileged, they have not had the adversity that black kids have had. And now all of a sudden, the Klan have took their hoods under their collar, discarded their robe with the 3-piece suit, a dress, and a pantsuit, hiding in plain sight, and the pen is mightier than the sword. And these kids don't know where they've come from or where they're going. You have to have a reference point. So I would like to see in a forum where you don't have a free-for-all, just people to sign up and speak for things from a black perspective, since it impacts us most of all. And just to come and to speak, since everything seems to be directed at us, because everything that's happening in the black community is by design. Yeah, and we have shootings down at the Raleigh Center, And it was, I mean, there's some similar to a shooting every day, somewhere around in the metropolitan area. And I'm a community activist, a real true community activist. I did a commentary for our black newspaper for a year and a half. And I know our time is limited. I didn't mean to speak on all this, but while I've got a chance to. And from Roberts Park area, from Hargett to Martin Street, less than 10 years ago, there were 9 drug houses in my block. There is a hit on me as I speak, because I'm the only one that's trying to do anything about the drug dealers that's in my block. And back in the 30s, there was a system called redlining, where black people could not buy a house in a white area. Now it's a white line with regentrification and gentrification, where white people can come in and buy $500,000 houses. And that's a form of discrimination too, because if you deny a person a chance at economic parity, they can say, come right on in. There's no discrimination here. It's only $500,000. Because one block from me, a house just appraised for $800,000. They just sold a house right next to me for $564,000. And the apartment, the house right next to me, just rented for $1,750. You have to make 3 times the rent. So I just like to see you have a forum where people can come in and speak from a black perspective, because it seems like everything that's happening is to us, because every probably has a chance to thrive except us, and there's a reason for that.
Okay, thank you. Could you communicate that to the county? Thank you. We're going to wait on any additional comment. I thought he had a question about what was just here. We have one more presenter.
Yes. So next up, we have finally Mr. Bill King with Downtown Raleigh Alliance is going to come and provide an update on their efforts to secure areas throughout the footprint of downtown. And also, I think they're going to, Bill's going to provide an update on some community conversations that DRA has facilitated since the date of the last committee meeting.
All right, is this showing properly? Slides? Are you seeing it on your monitor? Okay. Bill King, Downtown Raleigh Alliance, thank you for having me. I will just give a few brief updates on some progress since the last meeting. So I'll remind you all of just sort of the nature of our safety and advocacy program around this. We do have the Ambassador Program, which we've done a lot of changes to this year, and then obviously working with you all on these safety enhancements. And then, as you've heard a lot today, social services support, we're involved in this as well with our 2 social outreach ambassadors who work in close contact with your ACORN unit and the county as well to help those in need. I'll also remind everyone that this is a really complicated topic. So I went through this in depth last time. I'm not going to do that this time, but I do want everyone to be thoughtful about how we talk about this. Those who are unhoused, dealing with housing shortages, dealing with shelter capacity issues, a tough network of services to understand and access to those. And then some are also experiencing mental illness and crisis, who are also challenged with lack of services. And then there's a third population here who are neither unhoused nor necessarily in mental crisis, but just involved in problematic behavior. So there can be overlap here, but it is a really challenging and nuanced conversation. So I appreciate you all for approaching this in a way that also includes social services and includes all of this, because this is a really challenging topic. And I think it's easy for many people to just conflate some of these populations when in fact they need different remedies. One thing I do want to talk about is really sort of the layered approach that we've been working on here in downtown this year with the city. And you heard the chief last time talk about this in the context of force multipliers, which is really meant to say that some of the stuff that we help provide or support are really meant to be additive to Raleigh Police's efforts. At the end of the day, public safety in downtown is reliant on Raleigh Police. So it's reliant on their responsiveness and their resources. There's a lot of issues that only they can address. What we try to do through our ambassadors, private security, which I'll talk about in a minute, and the security camera network is add to that and help complement that and supplement that. So on the ambassador side, I mentioned this last time, but we have made some good changes here. We did change our vendor and have added some new staff and also some new vehicles that have been able to increase our deployment time, which has been helpful, as well as change our hours. We do have 2 routes here in the core where we have ambassadors patrolling almost all the time. So one is going in one direction, one's going the other, so that ambassadors are frequently seen here in the core where we've had a number of issues. And then we also do patrol until 3 a.m. on Friday and Saturday nights in Glenwood South as well. So provide a lot of support there, particularly on those weekend nights for eyes and ears to help Raleigh police in that district. I mentioned Project Reach Out last time, which is something we do frequently, and that helps connect those in need with social service vendors. We have had support from both your Acorn unit and the county on that, and I believe the city's Acorn unit is planning a similar event soon. So it has been successful at creating some of those connections and bringing the services to those in need. We've staged that in Moore Square several times. This is just a quick snapshot on our ambassadors in September of 2023. So a few things I want to highlight. They had 78 calls for service. So those are when somebody is oftentimes dealing with a problematic individual, they'll call the ambassadors. They're trained in de-escalation. So they try to come, they assess the situation. If it's too dangerous for them, they will call the police. So you do see also requests for RPD on there, 33 of those. But if they can de-escalate it and handle it without police, obviously that's ideal. We did over 2,300 hotspot checks, so we have hotspots where we have the most issues of areas of most issues. So they check those on a frequent basis. We did 54 safe walks. So for any downtown employee, resident, visitor, if you're feeling unsafe going to your car, we provide safe walks. And then you can see our social worker team, over 120 wellness checks, 30 referrals for service, 31 counseling and follow-up sessions. And then in September, they were able to help 2 individuals secure housing, which may seem like a small number, but that is substantial. One of whom has been somebody who's been chronically unhoused, very well known to those of us downtown, does have some additional challenges, and getting that person to housing has been a great help. So proud of our team for that. I mentioned last time the research we did for what other cities do. I won't review that again, but only to say that the next couple of items are things we found as best practices in other cities, one of which is that camera network. Chief Patterson mentioned that last time, the Fusus network. This was purchased this summer, finalized by the city, and is being set up as we speak. We are holding some demos virtually for businesses and property owners to facilitate entry into the system, and this is really an optional camera network. So this would knit together your public and your private cameras. The property owners and businesses have some level of ability to choose how much access they give, from full to sort of a more removed access where they're alerted if there's an issue, and then they choose what access they do or don't give. So we are staging some demos for that to try to increase that. There are a number of cameras in the downtown area, but access to those is pretty challenging. So when an incident happens, it takes a long time to be able to get any sort of evidence of what happened. So we're hopeful that this can speed this up and maybe even lead to some more proactive reaction. So if you're seeing an incident start to brew, late at night in Glenwood South in the public right of way, the potential to be able to deploy resources there faster through this. Additionally, private security. So you heard here from your Go Raleigh staff on their private security and what they're looking at for the transit center. What we are doing is adding some additional private security to enhance our ambassador team, and that would be starting next week. Would be a 7-day week, 10 a.m. to 10 p.m. patrol. We've really asked them to do a few things. Be active and visible foot patrol. So we don't want them coming and sitting in a car. We want them to be walking around, creating a noticeable presence to deter any criminal activity, notifying police immediately when witnessing any illegal activity, and then also doing some engagement with the business owners and staff on those routes so that those people know them. Ours will be unarmed. That's something we insisted on for us. We feel like that's most appropriate for our organization. They will be wearing body cams. They will file daily reports to us. And any serious incidents get an automatic alert to our team. So if they are involved in any sort of incident with someone, or if they have to call the police, we get an automatic alert on that. We also held a community meeting last week that was at Marbles Kids Museum with residents and business owners. Chief Patterson and the Downtown District Command were there and came and spoke and took questions. We really appreciated that. They stood and took a lot of questions from the community. And we also had Pastor Vance Haywood, who is helping coordinate the White Flag Shelter. And so again, we're trying to make sure that this is a more comprehensive approach to the nuanced issues around downtown safety. So Pastor Haywood's been working on coordinating the White Flag Shelter as we enter cold weather, which is a challenging coordination. I believe it's at 35 degrees or below. These shelters become active. So it's a really, really important service. Our ambassadors spend a lot of time trying to help people find this. So when we have a White Flag night, we try to make sure that we're ushering as many people to this as possible. And so it's also helpful for our residents and businesses to hear about it. Some of the feedback in that community meeting, there was strong appreciation for the increased RPD presence over the last month in the core of downtown. There's a concern for what happens if it reduces without a plan for additional support that can handle some of the seriousness of some of the challenges that we see. And then support for increased shelter capacity and day shelter here in Wake County. So by having that conversation on White Flag Shelter, we had a pretty robust conversation around shelter in general and the resources to help those in need. So it was a conversation on both safety and housing. I mentioned a lot of this last time, the things that we can't accomplish, we need help with. Many of these things you all are working on or talking about. Obviously, transit police and continued police support here, more social service support around supportive housing and shelters. You've heard about the camera network. In a previous, a different committee, or excuse me, a work session, you all talked about really your public realm, your landscaping, lights, pavers, tree wells. Those can be small investments and feel marginal, but really they do help. They are not the core solution to this, but they are very helpful in creating a downtown that looks and feels better. Enhanced cleaning, particularly around our transit center, and dealing with the trash cans and rollaway carts there that are all over the sidewalk around there would be very important. But the biggest thing I'd say is, and what I'd encourage you all as a committee to think about, is we really need a long-term durable plan for securing our downtown. This year got to a place that was not acceptable for downtown, and we really appreciate all of the support that we've gotten over the last few weeks. It has made a tremendous difference. And we appreciate how difficult this is. We do not want to be in a situation where next year warm weather picks up and we're right back at it and we're kind of on our heels trying to figure out what do we do, right? So I would strongly encourage a long-term, durable plan for what downtown security looks like in the future from a resource perspective, from the different types of force used, the different types of social services used, and all of that. I think it's going to be important because these issues aren't necessarily going to go away. So I would strongly encourage you all consider that because I think it's been very helpful the last few weeks, but we do need to continue to work towards a longer term durable plan for how we keep this downtown safe. It really is the fundamental part of downtown. If we don't have a safe downtown, it is very challenging to do much else to bring it all the way back and take it to the new place we want it to be.
Bill, how many people attended your community meeting?
We had
And
over
was it
50 people.
businesses and residential?
Yeah, we had over 50 people attend.
Okay. Are additional meetings planned?
We don't currently have an additional meeting. We do a regular community meeting, so we folded this into that agenda called Downtown Rundown. So we do those every few months. I believe there is, we've been talking about an additional meeting in the Glenwood South area potentially.
Yep, that's what I was referring to.
Mm-hmm.
And so you're working on that then?
Mm-hmm.
Okay, thank you. Any other questions for Bill?
Yes. Can you go back to the slide where you were discussing the calls for service as opposed to the RPD calls? So it was like 78 and 33. Yep. Just for clarity, those calls for service are when there was something that your ambassador is viewed as a threat. So those are 78 calls for that.
I wouldn't say necessarily a threat. So it's whether a resident or a business or a visitor called them for assistance. That would be outside of directions and hospitality and outside of what the social workers do. And so it would be calls for service can be anything from we have an aggressive individual in here to something different that they feel like they need assistance with. So it's a pretty broad range of what a call for service can be.
Awesome. But that only resulted in 33 requests for RPD to where an officer was needed. So there's a big gap of what your ambassadors were able to help solve. Yep. And I really think that speaks to a big general, as we're talking about police and security and all that, how are we also folding in services that are not police related, and how are we making sure that those are being activated as well? And I hope that as we continue this discussion, to your point, for next year, because as you write in here, June 30th, this plan is done. I'm assuming that aligns with our budget. And so we don't know what that plan is. And that's when we saw the uptick this year, was during those summer months. So hopefully we can use this time to wrap in some care and some services or just touch points that are not security related that residents can use. So I appreciate those stats because it really speaks to that topic.
Yeah, absolutely. And I think it's also worth noting on the private security side, we do not intend that to be a replacement for the RPD force downtown. They cannot be. Again, they're unarmed. They don't have arrest powers, all of that. So I would just caution that I know it's challenging to keep that level of resource down here. I understand that that's a conversation for you all and your staff to figure out, but private security is meant to be a force multiplier, not a replacement.
And Councilmember Jones, to that question, I don't think Bill mentioned this. There's the ambassador program, but he also has a core of social service workers. I know that we have provided support for. Do you have 3?
We have 2.
2.
And yeah, those were some of their stats were on there. So when I highlighted on the right side there, so some of the outreach and quality of life. So that's some of their work in September. And again, they were able to help secure housing for 2 individuals who have been chronically unhoused.
Any additional questions?
And this might be for city, the work that they're doing and able to assist with housing for those 2 individuals, are they working with the city to also, are those social workers working with DRA also working with the city and Acorns unit?
I don't know, Bill, that might be a better answer for you. In terms of how those individuals, I think Councilmember Jones, just to understand your question, you're saying how is that connection being made? Is it interacting with the city directly? Bill, maybe I'd look to you to see if you have some insight into how those particular connections were made. I'm not sure if they interacted with us directly, but
so they absolutely interact a lot with the Acorn unit. Okay. With regards to housing, they may or may not, depends on the situation. What they do have is expertise in housing vouchers and what that system looks like. It's a challenging system. I mean, it is a challenging system for any individual to get through. So it's a lot of what we're doing is sitting down with them. First off, to build a relationship with them, you got to build a lot of trust, right? And so that takes potentially a very long time. And then you work with them to work through, to be able to get through that system. And sometimes it starts with getting them an ID or getting them, the ability to have some address to receive mail to, things like that, to be able to get them where they're at a level of qualification. So a lot of it's just working through that system. But yes, they communicate a lot with the Acorn unit.
Great. And then lastly, I know that the last time you were here, we discussed you have the 3 different sections. You have the unhoused, you have the criminal activity, in the sense that we were seeing possibly children coming, teenagers coming on buses and coming through. How has that been over the last few weeks? And what do you think some of those solutions were or to solve it, if you've seen a positive decrease in that?
Yeah, we have seen a positive decrease. I think that, it's been an interesting trend. I think you saw a large number of juveniles coming into the area of the transit center to some degree. I think teenagers, like to be around teenagers, so it was sort of building on itself and more people would come. We've seen the size of those groups go down tremendously. I think a lot of that is just the presence there that has been there for the last few weeks, which has been greatly increased by RPD. And our ambassadors are there as well. But I think that has sort of dissipated that, so then it's smaller and you're seeing much smaller groups. So it has dissipated a good bit. I can't identify all the reasons why other than that, but there's a clear before and after. The situation beforehand was pretty stark.
Thank you.
Okay. Any other questions?
I'll just add to, I think, as Councilmember Jones is mentioning, making sure we're taking a holistic approach that doesn't only include like a law enforcement or similar response. I think in your presentation last time, you showed us a map of the downtown core where, and some areas get like sort of an enhanced zhuzhing of cleaning, and that maybe this like infuses like a presence of people who are sort of a uniformed official presence, but they're not meant to be law enforcement. They're landscapers and street sweepers and other things like that. And so I just hope, I'd love to see us explore where things like that, sort of like your mom vacuuming under your feet during Saturday morning cartoons, like eventually it gets so annoying that you move on. So maybe we can explore things like that too. So.
Yeah, absolutely.
Okay. Any other questions? Okay, what I'm going to do, we're running out of time. If anybody has a question, please come up and give your name, please. And if we could set the timer, I'm going to do 2 minutes.
Good evening. My name is Octavia Rainey, and I would like to say I have been training seniors to catch the bus for 20 years. I am appalled at what I heard today, and y'all should be appalled too. Anytime you have somebody to tell you in security that they are not coming down to the bus station because they can't be armed, that's ridiculous. That is ridiculous. And let me remind you, I think y'all are skirting the table here now and not telling the truth. In 2011, y'all hired private security for Moore Square's bus station. That security had a gun. He had his knee on this guy's neck. We all rushed over there. I don't want that to happen again. You don't need armed security. You don't need it, and I object to it. The gentleman had to carefully watch his words, and he was right to do that because I was listening. I do not support that. You can hire a private duty team like Dennis Gaddy to come down there and provide security. They aren't scared of the folk. It sounds like this security is scared of the black folk. And I'm sick of that. I'm sick of y'all putting down black people. This is not your first time. You did this same thing with David Diaz, had a big thing over at the museum. I was there. I got my notes, and I went back and got my notes last night because I knew I was coming today. And the same thing the people said, it's the same thing they did. When are you going to go back and review? Do I need to bring my notes so we can all sit down and have a come to Jesus talk now? I don't support that. I told Mr. Davey I need to talk to him because somehow there's 2 sides to this story and it's not being told. And I think it's unfair. What the city is really dealing with, as you grow, you're going to get crime problems. That's what y'all need to be addressing as you grow, as you add on. Downtown is not the same. Glenwood South is not the same. So it calls for a different strategy. And I heard Bill, but I would like to have a conversation with Bill because we got to review this first time. Y'all moved out the Salvation Army and all of that stuff, Moore Square, to get to a perfect downtown.
Thank you.
But I object to that.
Okay. Again, this is for questions.
Yes, I have a question. I think I was talking to Captain Rowland. I guess he's Major now. But we were talking about some police officers that patrol our neighborhood around Boylan and Peace Street on the weekends from 11 to 4. And they're paid through comp time. And when I was talking to him, I said, well, when you have a huge event downtown, like, let's say Bluegrass, I said, how does that work? And he said the organizers pay them time and a half. I'm not too sure I got all the facts straight, but it seems to me if we're asking police officers to come into an area like Glenwood South, which can be pretty dangerous, that we shouldn't just be paying them comp time. It seems like we should be paying them money. Can somebody respond to that? Do you know what the policy is?
I don't think we have anybody from RBD, and I don't know that information offhand, but we could come back with that.
We can get that for you.
I would really encourage you, though, if you're going to bring these people in, I think it should be more than comp time.
Thank you. Could you reset? Mama Kai, do you have a question? Could you reset the timer, please?
I heard you, Mayor. Good afternoon. My super shero name is Mama Kai. My government name is Cara Lynn Sanders, and it's another amazing day in paradise. Thank you so much for this forum. I've never come to this meeting, but with some of the things that I've been hearing, I've been very concerned. The two questions that I had, well, there's kind of three, is anybody doing anything to address early childhood development now? Because if we don't, there's going to be these problems as exasperated in 20 years, because there is a direct correlation between early childhood trauma and adult mental illness. That's the first thing. The second thing is, what is the difference between the situations that are brought before RPD that are unhoused or homeless versus housed, and versus stably housed? And then the last thing is, I'm curious about how much of this is alcohol related, how many of the problems are because people are out there drinking too much. And as we continue to increase the social district and we create these mixed use developments that are mostly supporting restaurants and bars coming into downtown, how much more of this is going to continue to be a bigger problem, because we're not bringing things in that are family friendly, where children can come downtown and have a good time with their families without alcohol being involved. I know when I was growing up, people didn't smoke. You didn't see people smoke. Children didn't go into restaurants. And now you can go to an event in Moore Square, and they're selling wristbands. Parents are walking around with beers and pushing the baby stroller at the same time. And that's that triggers my nervous system, because that was against what I grew up with, And so what kind of environment are we actually creating when we're allowing these things to continue to grow without really asking the question, what are we looking for downtown, and who do we want down there, and do we actually have the things to provide it? Thank you.
Thank you.
Good afternoon. I'm Angela Floyd, 618 North Boylan, Paramount Condos. I had more information, but I do have a couple questions. One, last time we had a safety meeting, Chief Patterson had a couple of issues that she recommended that I thought were really good, and I wondered why they weren't considered with the noise complaint, which, really impacts crime. And I'm talking specifically about Glenwood South. I think Fayetteville Street and Glenwood South have different approaches because there are different issues. One of the things that she talked about was recommending, she did say that she didn't think enhanced police in the Glenwood South area was necessary long-term, and I wholeheartedly agree. I don't think the noise issue, needs a police presence. I think we're focusing, again, I've said before, the symptoms and not the cause. I think the cause of this are related to the bars and the noise and the non-compliance. She recommended magnetometers for the bars. She also recommended that Glenwood South implement a cut-the-line policy, where when the bars had long lines because they were full, that they be required to disperse that crowd outside. And Mayor Bolden, I think you asked for your city attorney to look into that, but I don't see it in the noise ordinance policy. Thought it was a really good recommendation. We had an incident last Thursday night in Glenwood South where I called at 11:30 to report a noise violation with Alchemy and Cornerstone. Several other residents in our building also called. They told me later, same two bars. We had one of our residents go down to the bar at 12:14 a.m., and he spoke with the police officer that was standing in front of the bar. And he asked, on a Thursday night, why would we have music this loud? And the police officer responded, we have a special event permit, which was not true. So that's a question. Why was that response? Thank you.
The question was, okay, a couple of questions here. One was, what happened to the chief's suggestions for
Yes.
magnetometers, and then the cut the line. So I
Yes.
think that's something we're looking at Evan. Was there additional question there
Yeah,
related to?
there were two
the special use
recommendations,
permit?
and then the resources. Those three things was my question about Chief Patterson. The last question was, why did the Raleigh Police Department tell us that there was a special event permit for that club? And I called and followed up. The special events office confirmed there was not. So just a question about why that was miscommunicated. Raleigh Events Office said they would follow up with this nightclub about it, but just that miscommunication, it was kind of a question mark for me.
Well, we've noted that, and staff will follow up.
Thank you.
Thank you. Okay, we are out of time right now. I'm going to see what the consensus is among the committee. I think that we should report this back out with some steps that we need to take or provide staff direction regarding next steps and what they need, what needs to be done. Some of what I heard today was identify long-term policing plan. That was from DRA for both Glenwood South and downtown. I believe there's consensus to proceed with a plan to reinstate fares and have staff come back to us with that. That's something I've heard from other council members as well. Obviously, we want to continue working with the county and DRA. And what I would like to see too is DRA hosting this Glenwood South meeting, but the city working very cooperatively with them on that. So I just want to get some consensus here.
For me, I think one thing that was brought up was the non-security forces solution to add to the mix so that we're not just focusing on security issues, but also how can we holistically look at everything. I think that Mama Kai brought up.
Do you mean the behavioral health and mental health part of that? Which the county-
That, no, not just the county. I just mean different solutions and nothing that we discussed today, specifically. But I think part of the security is one piece of the puzzle that we have, that has been added, that we as council have not added, but it has been there. So that is one piece currently. And another piece that I'd like to add in is what options do we have? What different alternative strategies can we use that are not focused on security, that we can deploy in our downtown area to help with security? Not security, I'm sorry, to help with downtown safety. So that's something that I'd like to add to the mix. I think Mama Kai brought up a great point. I see my friend Manuel Daniels here, who I've been speaking with. And as we talk about the social district and the great things that it does, I also think it brings up some challenges. I think that especially when you have a district that's standing there right across the street, people get arrested for the same thing that people are doing on one side of the street. And that tends to really affect Black and brown members of our community, our unhoused community. So I'd really like to see how we can make that not such a distinct difference, especially since we have the social district. So I think those are great points brought up by the public that need to be addressed as well in whatever recommendations. I'd love to have further discussion because I don't want to sign off to recommendations that we haven't just heard from, that we actually discussed about our opinions on as well.
Yeah, I'll just add, I was waiting for us to bring it back to the table, wanted to get through all the presentations and stuff before I kind of summed up where I'm at with this right now. And one thing that we've heard from members of the public, but I also think is still missing for me is an answer to what happened that instigated this. So we heard at our last meeting on this topic that it started about like 9 months. It was 9 months ago when people were talking about it at that time. So 10 now. And I think Bill did a nice job highlighting that there are these distinct groups, and not all of them are creating trouble. But I think I need to have a better understanding of what might be, like what happened. That 9 months ago, it's not when we made buses free. It wasn't the summer. I think I need to have a better understanding of what might have precipitated some of this. And I had hoped maybe some of that information would be available today. I also think there might be an opportunity to collaborate with our partners at the not at the county, at Wake County Public Schools, because if youths are coming in on the buses from elsewhere, we can probably know where they're coming from and what they might have been doing 10 months ago before they started coming downtown. Where, if they're coming down in the middle of the day, where should they be instead? And can we close gaps in the pipeline there? I'm not 100% convinced that reinstating fares is going to solve the problems it's aiming to solve, as we already have all of our minors are already able to ride the bus for free. And so I'm not sure it's going to solve the problem we think it's going to solve. That being said, I'm certainly open to further discussion.
What I had said was ask staff to come back with a plan that we would be presented with, and we can address that at a later time when we're looking at our budget.
I'm not looking at the budget.
I'd like to just jump in right there. I think my confusion with, and I don't know if you echo this at all, but we've had 2 meetings. I don't know what we're recommending out. I don't understand the conversation. We've had some presentations again, but we're not, I'm not ready to send anything out of committee because I don't think that we have a grasp on what possible solutions could be.
That's why I wanted it to go out of committee with some recommendations to staff to come back to us with specific items that need to be addressed.
But why wouldn't they come into the next month's committee so we can understand it before we send it out to everyone?
Well, I think some of it will be longer term, like the fare free. That will come to us when we start talking about our budget. But I think right now, staff is looking for some direction about where we want to take this.
Right, and I don't know what that is yet.
So I wonder if maybe this threads the needle. So maybe next month we get a slide from staff that has 10 options. That says you could reinstate fares now, you can reinstate fares at the new budget cycle, you could hear the RFP, it has 10 options, and then we as the committee say we endorse options 2, 7, and 9. Go and bring more information to the full council about those ones. Maybe we do it that way.
Well, or maybe if we just send it out, then other members of the council will have opportunity to weigh in. So instead of bringing 10 options to us and it's just the 4 of us, you bring 10 options to the full council, and folks get an opportunity to chime in about what would be useful or helpful or not. So it gives the full body of the council an opportunity to sort of weigh in versus the 4 of us making those decisions and sending it back to the table. I guess that's is that?
Yeah.
I see the assistant city manager shaking his head, so.
Yeah, I think, that'd be helpful. I mean, committee has the discretion to go whatever way you want to go in terms of framing this up, but, certainly could see value in that. But again, that's the discretion in terms of how you all want to treat this. We can come back to the committee. You can report it out. We'd be bringing those same options if kind of along the lines of what Councilmember Patton described. It'd be that same conversation with the full body. So I think that's, again, just up to you how you want to treat it.
I mean, I think we're kind of splitting hairs about whether the list of 12 options goes in front of the full body first or goes in front of us first. It's a little bit of splitting hairs maybe, but.
Would you be okay with Councilor Fort's suggestion on having that come back to the full body for discussion with that list of here are your options and what would we like to see?
I would not. I think that there needs to be another discussion. I enjoy when the public comes and speaks. I think they need to see the presentations. Just because we recommend something out doesn't mean that's what has to happen. There's still going to be the 12 options. We say the committee recommends this, and then having that full discussion. But this is a big topic that I really don't understand what this committee did. I don't understand what our purpose is. And if we're just here it just feels like this is a delay tactic without having any resolution. So I'd much rather come to some agreement among the committee as to what we would like to see, and whether or not the full council takes it, that's the full council's decision. But right now, we're not coming with any more clarity to the council than we came into this committee with, and I feel like it's been a waste of time.
Yeah, I think my preference would also be to see it one more time with this group, a list of however many staff deems appropriate, 10 or 15 options or whatever, and have just the teensiest bit of meat on the bones that help us understand. I want, when we go back to our colleagues, I want to say, here are things we vetted, and these are the ones we endorse. And
So but we need to give staff direction on what those items are. What do you want to hear from them? Like I mentioned, the long-term policing plan, proceeding with the plan to reinstate fairs, the coordination of the Glenwood South event. You had mentioned the non-security options, which I'm still not clear on the specifics on that. You had mentioned working with Wake County schools. So those are the things that we want to give staff direction on. Is that consensus?
yeah.
Yeah, and I thought that we would talk at this point about what those could look like. No, I don't have a specific thing, 'cause we just came back from our presentations and listening to the community. But if I'm looking at things, I'm really proud, like I said, of Bill's and DRA's use of their ambassadors to where they were able to really mitigate some concerns. So they only used the RPD 33 times. I'd love to see what are some ideas that we have that we could do the same thing? Is it, I mean, just throwing stuff out there, is it activating, whether it's landscaping and having more people out there cleaning up, or is it putting chalk on there? Are we having our arts community come out and do events right in our hot spots so that we're deterring any activity that could be criminal? I think those are things that I figured right now we would vet before we make a recommendation, because I don't know what that could look like in your mind or what that could look like in anyone else's mind.
Staff, do you have clarity on what the expectation is for the next meeting?
I think we do. I will say, just because I don't want to have unrealistic expectations set. I think some of these things are not going to be items that in a matter of 3 weeks that we can come back to you with something substantive. I think some of these more discrete items, certainly as it comes to potentially the staffing plan for Fayetteville Street, downtown, Glenwood South, I think we can come prepared with more discrete conversation around fare-free options. Certainly the meeting, but
the other thing is, if you need more time,
yeah, I think
then you can just let us know that.
Sure, if the committee's okay, we can take this approach. We'll see of this list what we can reasonably come back with and have a well-articulated discussion around. But some of these things I know are going to be beyond just a month in terms of time we will need to evaluate some of this. Okay. So.
And I see Paul is in the audience. The last time he presented, you don't have to get up, Paul, but I was just going to say, I know you were going to give us an update about the lighting issue with Duke or Progress or whatever it is at this point, and the cameras that are going to be installed. So if that could be on the list too, that we just get the update about the lighting and the camera system as well. Since you're here, Paul, put it on your radar.
Okay, thank you. All right, if we're good, I'm going to adjourn the meeting. I just want to thank everybody for coming out, and be on the lookout too for information from DRA on the Glenwood South meeting. Thank you.